Basically, a human OB-GYN was doing surgeries without a veterinary license on animals.
This is crazy.
She was initially reported in 2022.
She gets no prison time, and she still has her own business.
They seized 34 French bulldogs, a lab mix, and 2 cats from her.
Like, she is still an OB-GYN with a license. Hello, everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know.
Let us know.
Okay.
All right, where are we at with reviews? Let's see. Okay, last time on Apple Podcasts, we were at 128, and now we're at 129. Creeping up. Okay, Spotify, we were at 328, and now we're at 330.
Woo, woo, woo.
So, okay, we're averaging a couple a week.
That's pretty awesome.
That's not too bad. But don't forget to write us
those reviews.
I know.
That's right. We love those reviews.
We like the nice ones.
I don't know if we get very many bad ones.
I don't know. I really don't.
Harrison usually tells us. I don't know.
It's true.
I have not heard anything in a while.
So write us a review anyways, even if it's like, I love my cat.
There we go.
There's got to be something with the algorithm, right?
I have no idea. I have no idea, honestly.
And follow our nonsense on Instagram and TikTok. At the Veterinary Roundtable is our handle. We also have our own YouTube channel where you can have all the video podcasts at your beck and call, and they'll all be published. It's at the page that's called the Veterinary Roundtable.
You could just listen and just keep listening.
Yeah. You just keep going.
Keep going.
Keep going.
That's right.
If you want to watch, you can, but right now there's not much to watch.
There's not much to watch.
The special episodes are a good one to watch.
Yes.
If we do like drinks or something, or the surprise bag, which I realize we haven't done a surprise bag in a while.
We're going to need to do a surprise bag.
Yeah, I know. I was thinking about that too.
Yep, that's a great idea, actually. We need to do that in the next 1 or 2 episodes.
Okay.
Bring
Spice
it
up.
back.
Yep.
Okay.
Well, I'm Dr. Ashlyn Duckwall.
And I'm Dr. Emily King. And Courtney is stuck at work, which is going to be her pit. Maybe it's her peak. I don't know. But she's stuck at work. So she's on her way here. She's going to be jumping into the podcast as soon as she gets here.
Yeah, she will be here soon. It's probably her pit because she had to stay late for euthanasia. Yeah.
I was thinking if it was a peak because she didn't have to be here with us.
I think she likes us.
I think she does. You're right. Okay.
I think she enjoys us yapping together.
That's true. That's true. Absolutely. Okay, so speaking of pits and peaks.
I know.
What have you got?
Well, I'll start with my pit because I actually thought of that one easier. That's kind of depressing. I don't know.
That came to mind faster?
It did because it was last week. I had on 2 different days, 2 different occasions where I had to have a behavioral conversation with 2 different owners. One of them was a new client. One of them is a client that I've had. And the dog has always been a basket case, anxious at the clinic. And we've talked about his anxiety every year, and we tried Prozac, and, we've been working on it. But both cases, which is a pit, involved biting children.
Oh.
Yeah.
That's no fun.
No. The new client entailed their own child, who's a 2-year-old.
Oh, no.
And they know their dogs. They knew their dog's personality, the behavior concerns. They actually did a lot of different ways to avoid that type of confrontation. They would barricade and separate them, never left unattended. So they did what they could. The dog was on medications, came into the clinic muzzled. I mean, this dog was he wanted to bite me, and they just said he doesn't like anybody.
Yeah.
Just his people, right? Which was the 2 owners.
Clearly not the 2-year-olds.
I know.
It's not considered one of his people.
Well, and we narrowed it down. And for that dog in particular, it was truly just his bubble. He did not want people touching him or coming close to him. And even a situation was sad. They said there was one of their friends that they thought was one of his people they had met before. He bit him. He bit an adult. But in this 2-year-old's case, thankfully, it didn't go through the skin. It was a bruise, I think, more or less. And all she was doing was walking by and put her arm out. And
Gosh.
So that was, in these cases, I'm just kind of more aggressive and honest. And I'm just like, I know you don't know me, but mom to mom, like, that is terrifying. The dog was a huge English Shepherd, like 70 something pounds.
Oh gosh.
Who could do damage. And then the other scenario, it was still not great because obviously he had torn some clothes of some kids, like, and he's an Aussie Doodle. So then we were talking about like his triggers. Was it overexcitement, anxiety, and like the herding came out?
Sure.
That type of situation. But then she went on to explain her young kid, which is 2 or 3, even would just like sit next to him sometimes and he would growl.
No, gosh.
Yeah. So, yeah. I mean, honestly, we talked in both scenarios of all of our options, and it was not... I teared up in both conversations because you can tell the owners love their dogs so much, and these dogs love their owners. But when you put children at risk in the house, like, no.
Yeah, you can't.
No.
You know, one of the things I always tell people is it's like, it's not if it'll happen, it's when it's going to happen.
Exactly. It's exactly what
you'll never forgive yourself.
Nope.
Like,
and that's what they said.
You know, so it's...
both moms, like, that brought them in. Yeah. So it was sad. One of them...
It's so interesting to me how people explain away the dog's behavior.
Mm-hmm.
Have you know what I mean? Like in situations like, oh, he was just surprised.
Yeah. It was our fault. It was our fault.
He didn't see him coming from behind. Yes. Oh, normally he's perfectly fine, doesn't do anything.
Oh,
like,
he just got
it's
scared.
So interesting, as if it's somehow a reflection upon them or their character or something like that.
Yes.
Like, you know what I mean? So then they want to not blame the dog. Like, it's just fascinating to me.
And like the
happens.
new client, the English Shepherd, it was like that since a puppy. And the owner was still saying things like, I know it's probably our fault. And I was like, it is not your fault.
No.
There are truly some dogs that no matter what breed are just not wired correctly.
Right.
And you do what you can, but you can only do so much. Yeah. And it just... Yeah, it was really sad. Those are really downer conversations.
So hard. They're horrible cases.
I know.
Yeah.
Because they're otherwise healthy. But I don't know. So that was a really big downer. But you just go in there and you do the best you can. You give them your honest opinion. And I told them, I was like, if you asked 10 different vets, maybe they would give you different advice for each situation. But I'm a mom of a 2-year-old. In both these scenarios, I was like, I would not allow that in my household.
Yeah.
End of story.
End of story. Yeah. So I agree.
Yeah, that was a bummer. We don't get them that often, really. I can probably count on one hand on behavioral, whether you call it a consult, behavioral euthanasias, rehoming conversations. Like, I don't really get that many, which is nice.
Yeah.
But it also takes the people to like 4 or 5 instances to bring them in, I feel like.
Yeah.
When they realize, oh,
I need to do
it's the close calls that bring them in.
Yeah.
Yeah. So anyway, my peak is I got a hot date this weekend. I was filling out our calendar for the month like I always do, putting stuff down, you know, our schedules, our work schedules, whatever. And I was like, take me on a date, Charles. You've been taking me on a date in a while.
That's right.
So we're going on a date.
Where are you going?
Don't know.
Oh, you don't know yet. You're just
no
going
idea.
out.
We're going out.
Who's babysitting?
Grandma.
Oh,
Grandma,
nice.
Charles's mom, Grandma.
Okay.
Yeah. So I said, let's go like mid-afternoon. Let's do an activity and then maybe do some dinner or like a show. The possibilities are endless. I can't wait. I want to get dressed up.
Oh, that's so cute. That's amazing.
So I'm excited.
Are you going Saturday?
Saturday.
Nice. Mm-hmm. Very good. Very good.
I'll let you know. That'll be my peak next week.
That'll be your peak or maybe your pit next week. It can serve either one.
I literally had a dream last night that he didn't want to go on the date. So
oh my God.
obviously
hilarious.
I'm thinking about it.
Yes.
We'll see.
Let's see here. I would say my pit this week is I have a friend who is really struggling with loss and sorrow. And it's really hard because, you know, like when you're with them, you want to just be like,
yes,
we're good.
Yeah.
Like, come on, like, let's go have some fun. And they, you know, it's just so hard for them and you want to be there for them.
Yeah.
But you don't know what you're saying. You don't know what to say, you know, like to help them.
Yeah.
And, you know, like, it's just so hard.
Yeah.
And
it's a hard season of life.
Like, it is. It's just.
But you don't have to say anything. You just be there.
I know.
That's all anyone
wants.
That's
what I keep telling myself.
Yeah.
Is like, just
be there. Try to obviously acknowledge and validate what they're feeling, but then maybe try to distract them and go on with what you normally do.
Right.
That's hard.
It is so hard.
Yeah.
My peak is, what is my peak? My peak is probably that I got to watch the twins yesterday.
Yeah.
Yeah, it was a lot of fun. And they were very happy.
They're so cute.
They're so cute. Yes, they're very
They're still
cute.
a little wobbly.
Yeah, yes, and they got the squishy faces. So when they close their mouth,
yes.
it's like just cheeks like this.
I love it. Do you just like eat
Yes,
them? You
I'm just like, your cheeks are so cute. And you know what they think is hilarious? When you touch their chins. And so they think it's really funny. So you can go, woo, and they're like.
So it's the baby cackle. And then does one start laughing, the other one will laugh?
Not yet.
Oh, okay.
Not yet. No.
Okay.
Now they will. What I did notice this past time is one will talk. So he'll go, and then this one over here sitting with me or whatever will be like, and so I did notice that there was some, and I hadn't seen that before.
Yeah.
Of like them hearing each other.
Yeah.
But you put them in front of each other and they're like, like, what the F? Is this a mirror? I don't know what's happening here. Who's in front of me? And why do you look so similar but yet so different? And why aren't you moving your arm when I move my arm? It's so interesting because they totally, it's just like, boop,
that's
over
so
their heads.
Cute. So do they like calm each other down? Are they there yet?
I don't think they really do.
Do they hold hands yet?
Nope. They don't do anything like that. No.
They're still kind of blobbish.
Yeah. And now this time was interesting as well because I was sitting with them both on the couch and they have this one favorite toy that has all of these. Hello, Courtney.
She's here.
Hey, your snackies over there. It's with a spoon.
We got her a snack.
So I was sitting and I was holding the one toy for one of them.
Yeah.
And then the other one was sitting on my lap and he was like, he like looked over like this, like, why do you got that toy? And I was like, well, we can share it. Like, it was so interesting because they do so much talking with their faces and their eyes.
Oh,
you know, it's so interesting. So
it's going to be so fun when they start blabbering together and there's like that twin talk and that twin synchronization. Yes. Oh my gosh.
And then the running like through the house and then
they want to share. They want to
get it'll melt. Go grab it. You can if you want. Go for it. You haven't had food.
We're only on Pits and Peaks.
Yes.
We're just now cooking.
There's a spoon there for you too. Yeah, yes, ma'am. Yeah, that big one. Yeah, it's all you. It's got your name on it. Yep.
For context, King ordered Empower Bowls.
No, not Empower. But that's a great word. Let's start our own company. Empower Bowls.
Empower Bowls.
For veterinarians and veterinary technicians and veterinary assistants.
Everbowl.
Hello, Roundtable. Courtney's here.
Courtney's here.
You said what you were doing, so we thought maybe that was your pit, but we don't know.
Okay. It wasn't. It's not my pit.
Okay, great. Well, we just finished our Pits and Peaks.
Yes,
if you want to
do you want me to go?
Sure.
Okay. My peak is that I got to go home yesterday. So I pet sat for a week and a half.
Oh, that's right.
We were like, what?
Okay, sorry, context. I pet sat for a week and a half. So I saw my husband for like a total of 5 hours throughout the whole time I was gone, I think. So I finally got to go home yesterday and sleep in my own bed, which I haven't slept.
So nice.
Good.
That's nice.
My dog, so he's a cuddly dog, but he likes his personal space when he's sleeping, because we all get hot and whatnot. So, but he laid literally, we fell asleep touching noses and he didn't move 1 inch last night.
Oh.
And then this morning he followed me around as I was getting ready. He was like, Mom, please don't leave.
You're going to be gone for 2 weeks again.
Yeah, it was like he was attached to my hip.
That's so sweet.
Like, he's not like a Velcro dog by any means, but he had to be touching me. Like, from the second I got home to the second we woke up this morning, he was touching me.
Oh, that's so sweet.
That's cute.
Yeah, so I get to be home now.
Good.
Good to be missed.
My pit, I think I talked about Marty on the podcast, right?
Yes.
Yeah, you talked,
the Catahoula that had the splenectomy a week ago, that was my uncle's dog. And we found out his histopath came back. He does have hemangiosarcoma. So I'm just really sad for my family. It just sucks.
Yeah.
So it's
a hard
just
diagnosis.
crappy. Yeah. That's my pit because it's stupid.
And they just got home, so
yes,
now they can
so I was pet
him.
sitting for them. So they just got home from Europe, so they're still digesting
all the information. Yeah.
Yeah.
But he looked
he looks
great
good.
yesterday.
He looks like a brand spanking new dog.
Yeah,
he has never felt better.
Good.
Oh yeah, he's acting like a total crackhead at home, which I think helped them.
Yeah.
Because they were asking me I told my Uncle Chris, he didn't tell the family until they were home. But he every day, how's Marty? Like, is he okay? Like, do we need to do anything? Like, I don't think I think they, in their minds, he was going to look like a cancer patient when they got home, I guess. So it made them feel better, I think, to see him in person, because I took him home after work and he like literally got the Zoom. He started the whole house when he saw him. So
that's so cute.
Yeah.
I think that helped a lot.
Good.
Yeah, for sure.
Which is nice.
Yeah.
But
Yeah,
it just
seem
sucks.
to do really well until all of a sudden they don't.
Right.
Yeah. Which
Yeah.
I kind of told them. So just
And
week by
thankfully
week.
it's not always
month
right
by
away.
month.
Like you get that
Oh, yeah,
spleen
it's-
out
yeah.
and they do great for a long
Long
time.
time.
Yeah.
So they still got good quality life coming up.
Mm-hmm. Yep.
Okay, well, let's let Courtney eat and we'll read the next. We'll
Yes.
just go straight to our order
Yeah,
now.
I read last week.
Yeah. We're going to jump to Tales from the
Trenches. Okay,
If you're new to listen to us, this is a new segment where we want listeners to send in the most ridiculous, funny, unhinged stories that we then read on the podcast. And we also do not read them prior to the podcast. So this is our first reading. And if you have a story, send it to the veterinaryroundtable@gmail.com. So, okay. You want to do it or you want me to?
I don't care. You do it.
Okay. I don't think you've done one yet. So
I haven't.
You're next time.
Okay.
Yeah, you're
Okay.
next.
All right, here we go, gang.
Okay.
Hi, guys. I've been a listener for a while now and love your podcast. I'm a vet tech from Georgia, and we had a crazy case come in that I wanted to share. It's a 4-year-old male neutered cat. Not that any of that really matters, but the owner called around 3, stating that she had just got home from work and found her cat in the washing machine that she had started that morning around 10 a.m. This poor cat suffered and survived a whole wash cycle.
Oh my gosh.
That's impressive.
We, of course, told her to bring him in immediately, and upon arrival, he was pretty much unresponsive. And his temp was too low to even read. We started grabbing heating pads and warm fluid bags and blow drying while someone else is trying to get a catheter in, and of course, it's not going well. We finally got one in and hook him up with some warm fluids to hopefully get a temp to read. After about 30 minutes of continuous heating, we finally got a temp of 90.8.
Wow.
Unfortunately, the owner didn't have funds to hospitalize, so we gave several options and he chose to surrender. We then gave the cat a Dex SP injection and I brought him home to keep an eye on him through the night and to make sure he stayed as warm as possible. Miraculously, he made it through the night. He's pretty banged up, as to be expected, and definitely battling some aspiration pneumonia. Yeah. maybe a little bruised. Oh, he's also FIV positive, but other than that, and a slightly elevated ALT, his blood work was spectacular. He's not quite out of the woods yet, but this cat definitely has a life to live. A rescue that we work closely with has agreed to take him, and his new name is Maytag.
That's amazing.
I will send y'all an update in a few weeks on how he does. Thanks so much for all that you do, Amber.
Oh my God, that's amazing.
Animals are so
Maytag.
resilient.
They are.
That's insane.
You know what? He was probably just sitting. It was probably one of those front loader.
Yeah.
Like, and then he
Mhm.
jumped in with unclosed
Yes.
and was sitting there.
Yeah.
What do you think was going through his brain?
Oh my God, can you imagine him swirling around?
I think a front loader. Okay, let's think about this for a second. So a front loader agitates this way,
Yeah.
right? But if it was a top loader, it agitates. Which way would be better?
It has to be the front loader would be better.
No, bottom, because you could like get your
You would just be going in a
Footing.
circle
yeah, because you could be upright technically.
Yeah, but think about
versus being
I
like
guess
tossed.
the water fill. But
I'm not trying to laugh, but that's so because like you know what I'm thinking about. Sorry to interrupt you,
No.
but do you know
It's
what
okay.
I'm thinking about?
What?
No.
What?
Because when cats are really scared or like they get nervous at the clinic, they try to grab onto everything possible. And he was probably trying to grab onto the clothes.
Well,
but
there's
the clothes,
clothes on the
but the
side.
clothes were moving too.
The clothes are moving too. Yes.
Yeah, what if did he rip any nails?
I'm sure he was banged up.
That's probably the least of their concern. Any
Or
broken
did he ride
bones
one
or,
of those edges, like, and just like
Oh, yeah.
ride it?
I
and
wonder if
then-
they took X-rays of him.
or like how does the water come down? Like if it's a top loader, I feel like it would be easier for him to drown in a top loader, which he
That is
didn't.
true.
I agree
Good
with that.
point. That is true.
because it fills up
So
a
the
lot.
front loader is
Yep.
way better.
Yep.
Mm-hmm.
Mm,
For
okay.
Maytag.
Oh my gosh.
I always actually double check because I don't know. I don't remember the context of the story or where I heard it. So whatever. But I mean, the warm towels in a dryer, just
Yeah.
the warm space,
Mhm.
a cat wanting to go in there.
Yeah.
Whew,
Yeah.
scares me.
It is.
It's definitely very likely to
It's
happen.
yes, I know.
Mm-hmm.
Oh. Okay, well,
Okay,
he made it through the night.
Great story,
That's
Amber.
impressive.
That's a
That's
really
awesome.
great story.
Mm-hmm.
Wow. Wow.
That's insane.
I love the name though. That's amazing.
It's just so sad.
That's cool that the owner surrendered and let them like try to save him. That's really cool.
Yeah. Especially when it looked really helpless. Like it wasn't going to make it.
Like almost like euthanasia might have been a better option, but look at him now.
I know. Hopefully
as long as he heals from the aspiration pneumonia, as long as that doesn't get worse, because that can be scary.
Bad.
Mm-hmm.
Yeah.
Also, is detergent toxic?
Oh, for sure.
Well, I mean, if you aspirate it, but I don't think like on their skin, I don't think it is.
I mean, remember the trend when people were eating Tide Pods? That's natural selection.
Yes, it is. Absolutely.
So Maytag kind of had a Tide Pod.
Yeah, gosh.
He upped on the trend. He's on a bandwagon.
Okay.
All right, trending topics. Okay, the OB-GYN performs illegal surgery on dogs. Oh my.
Wow.
I read this and I was like, this is crazy.
I think what's mind-blowing to me is that she gets no prison time and she still has her own business.
That's the part that was mind-blowing to me is that her license is still in, like...
It's just on probation.
She's still practicing OB-GYN-ness, whatever that is.
Yeah.
Like, she is still an OB-GYN with a license.
This is like a national story, right? Like, people are going to see this and hopefully maybe
I don't know,
form their own opinion.
Yeah, I don't know, but I was like, oh my god,
I don't understand the license thing. Like, how do you
stay in your lane?
Stay in your lane.
Like, the people that get to judge on this, like your morals, like what? How do you let somebody keep their license or not do anything with their license?
It's because, and they said it in one of the articles, the way pets are viewed.
Mm-hmm.
They're just still all considered,
property.
Isn't it throughout the country, just property,
I think,
right?
I don't know if it's in every, I feel like maybe in California and then New York, maybe it might be trending differently, but I don't know for sure. I don't know if their laws have changed such that you can claim them as something like the damages as more than.
And I don't know if you claim it as like an emotional support if it makes it different either. Probably not.
Yeah, I don't know.
Or service dogs, are those viewed differently? I don't know.
I don't know.
Yeah. If you don't know the story, basically a human OB-GYN was doing surgeries without a veterinary license on animals.
How did she anesthetize them? Did she anesthetize them?
She was also
they said there was drugs and they just weren't handled properly.
The drugs were expired.
Yeah.
She also did AI, semen collection, and C-sections. That's what it stated.
Yes.
But like she was initially reported in 2022, which is crazy. Like, I know investigations take a while, but somebody called in and said she was doing illegal surgeries.
Yeah.
Like, and then it just like finally comes to like, that's just.
Yeah, that many years later.
Yeah.
Woof.
Okay.
It's just insane to me. Yeah, they
just
said
feel so bad for the animals. Oh my gosh.
In March of 2023, they seized 34 French bulldogs, a lab mix, and 2 cats from her residence.
There it is again, the French bulldogs.
The French bulldogs.
34 of them.
And they do need C-sections, but not from an OB-GYN.
Exactly.
All medicine is not equal, people. Right. This is the story. I will not pretend to do
the
human
repeat
medicine
story.
ever.
That's right. Exactly.
Gosh, that's insane that somebody, I don't know. And you're right. I mean, obviously not the right mind, because somebody who does that doesn't have a right mind.
No, it's just, sickening.
I didn't even think about the anesthesia.
I know.
Crazy.
Well, the next trending topic, not any lighter or better. It's a story about a vet tech that injects herself with painkillers.
Okay.
It also said in the story that it was buprenorphine and she took gabapentin.
Mm-hmm. I think in UK. Was it in another country?
I don't remember.
I don't remember reading that part.
I feel like it was in, maybe it's not.
I don't know.
I feel like it was in the story.
But then they described the story in
she was falling asleep.
Yeah. While she was doing anesthesia for a dental, monitoring, and she was falling asleep on the patient.
Mm-hmm.
Mm-hmm.
And they were like, "Are you okay? Are you okay?"
And she said she was just really tired because she said it was her birthday the night before.
Yes. Yeah.
It reminds me of the groomer that we used to have at the clinic. Were you there when that happened? And she had taken drugs, and a client had come out of the room and is like, someone needs to go talk to her. I guess the client was talking to her while she was doing the client's dog.
Yeah.
And the client comes out and is like, there is something wrong with her. I don't know what is wrong with her. No. And she's like cutting the air.
Like she was cutting all disarray, like not
even cutting the dog. She's
Just give him the haircut.
And so, I mean, it was horrible.
What'd you do?
I mean, we had to call somebody to come. I think we called an ambulance or the police. I can't remember who we called. We called somebody and they came and they were like, they were talking to her and like, listen, you need to whatever. And I think she went with them or she went home. I can't remember. But oh my God, I'll never forget that. Yeah.
Oh gosh.
Yeah, that was horrible.
This is just, I mean, this is just sad. Like when someone becomes dependent on that, they ruin their job.
I think they did it in 5 different clinics or something. Like there was like 4 or 5 different clinics that this happened in.
Yep.
Well,
it's really sad.
they caught her for that from stealing from the clinic. And then she was working at a charity as a nurse.
Yes.
So she said she would never do that again. She went down the wrong path. She felt horrible. And then she worked as a nurse at a charity event and did it again there. Stole more drugs from them.
Yeah. Addiction's hard, man.
Yeah. I can't. Yeah. I don't know. I have no word to say about it. But well, hopefully she finds the right help that she needs.
Agreed.
Absolutely.
And the right people to help her find the help.
Yes.
Okay. Well, very interesting topics there in the world. Case collections. I have one. Do you have one?
Mm-hmm.
Okay.
Let's do it.
Okay. So mine is a 11 to 12-year-old Australian Shepherd that I started just seeing last fall, probably. So a little under a year. And since the moment I met him, he had GI issues. He would have these like ups and downs, gastroenteritis. We always got them under control. Would have blood in it sometimes, the diarrhea, not really a vomiter. He maintained his weight fine. And we've done blood work and it was boring. So this next time, it was the 3rd time, I was like, all right, 3 strikes, you're out. Let's talk about either investigating more or changing some things up. It was the episodes are far enough apart that it wasn't driving the owner insane, but it was why I was seeing him every time where I was like, okay, we probably should look into other issues. So we started off by changing his diet, doing a diet trial, and then discussed further diagnostics such as an ultrasound and Texas GI panel if he didn't respond or, he wasn't eating the food, it wasn't going well. But at that time on the exam, I palpated him. He was fine. He felt fine. But I did a rectal just to make sure, everything felt fine. I usually do if there's really bad diarrhea. And his prostate was very large and very much palpable. It was symmetrical. It was smooth. And on rectal, and this is why you do rectal exams, I was like, that's really weird. So I go into the owner. I was like, hey, did the rectal, blah, blah, blah. The prostate was very prominent. Was he neutered later in life? And she goes, oh no, he was neutered like as soon as he could be, like 6 months. And he's 11 to 12-year-old dog. So I was like, okay, well, we need to monitor. We need to watch that. I know we're discussing all these other things we could do. And if we do the ultrasound, we'd obviously look at the prostate anyways. So he wasn't really responding to the diet and the Tylenol powder. So we ended up doing the Texas GI panel and an ultrasound. Texas GI panel came back normal. His total wellness was normal. And on the ultrasound, the guts were like very mildly thickened, not enough to say he's got IBD. Lymph nodes were fine, and his prostate was uniformly large. Dr. Dudley performed the ultrasound, and she said there was maybe an area of calcification, maybe, but it wasn't obvious enough to call it that.
Sure.
And she said, like, if that's really what it was, then you worry about cancer more so than anything else. But she said the position was it wasn't easy for us to be able to FNA the prostate. So I double checked. He's not, straining to urinate, nothing like that. Nope. Owner said it's just the defecation that's the problem. The soft stool is still straining to defecate. So I said, well, ultimately we have all these results. The prostate is probably our main concern at this point, or it is, because we don't have anything else to go off of. So I said the next step is referral to sample it if that's what you want to do. So they actually went to referral, and we went through oncology. The oncologist agreed with our findings and laid it out that they could do the BRAF test.
Oh, yeah.
They could do an FNA, or they could biopsy, and then they discussed a CT as well. They decided to do the least invasive method, which is the BRAF test. So they took a urine sample to basically look for markers for cancer. Came back positive.
Oh.
So their differentials are prostatic carcinoma or urethral carcinoma.
Oh, man.
Yeah. So I think at this point, my understanding is they're just going to start an anti-inflammatory. It was interesting. The oncologist started carprofen, whereas Piroxicam, I think, is better, or Daracox.
Well, I think that they've seen now, I think the research shows that there's not that much of a difference.
Okay, that's what I was wondering, because I've had that recommended multiple times, too, that carprofen would be just as fine.
Yep.
So, yeah.
Oh, that stinks. That's very interesting, though, right?
Good job on being thorough on your
exam.
exam.
I was going to say, more of the story is do a rectal exam and, be prepared.
Be prepared.
Mm-hmm.
That's right.
That's crazy.
That's a really interesting case, though.
That's it.
Are you doing one?
What you got?
Okay.
You go, and then we can see if we need to do another one or not. I don't think we do.
So I have chia seeds everywhere.
It's okay. They can't see you.
Okay. So we had a 1-year-old Maine Coon come in. He's a male. I don't know if he's neutered or not, to be honest with you. It doesn't say here. But he's a Maine Coon. So he presented for a spot on his back, like in between his shoulder blade area. And he had it for about a week. So it started off as like a small area of hair loss, and then it progressed to like oozing and itchy, and it was super uncomfortable for him. And then it turned into just like a huge, large scab. I have pictures so you guys can visualize it.
Okay.
So this is after we started treatment for a little bit. So it was like, I would say it was double this size, but that was after we started treatment.
Oh, wow.
Just so you can see. So you can follow along with the story.
Oh, yeah. Okay.
It was very, very
Big
large.
spot.
And it was completely like raw when we saw him. He went to an ER clinic before coming to us. They started Onsior and an antibiotic. And then he did receive topical Frontline about a month prior to this incident in the similar area, in the general vicinity. So he was on Onsior and amoxicillin when he came to see us. And so we did an exam. Everything checked out really, really well. He had pretty, though, severe gingivitis and gingival hyperplasia on his premolar and molar teeth on the top of his mouth. No ulcerations or anything like that. But otherwise, his exam was good, other than the gigantic raw spot on his back. So we had a couple things to kind of check off our list. So obviously to start with the wound on his back. So the things that were on our list were either some kind of burn, chemical, or something along like a heat or something like that. Fungal oh my God, I can't say this word. Pyogranulomatosis, dermatitis,
yes.
or bacterial. So what we did is we did a fungal PCR. We sent that out to the lab. We did do a quick skin cytology while he was in the clinic, and there was occasional cocci and rare yeast, so nothing super crazy. So we did the PCR, and then to touch on the gum situation, we sent out an FIV, FELV test just to kind of check that off our list too. So his blood work was beautiful. Everything was negative. We did a wellness panel as well. That all came back normal. And then the PCR was negative as well.
That's good.
So what we did is we started him on topical Xerisil.
Nice.
So we had the owner apply Xerisil. I think we had her do it once a day. I think we did it once a day. And he wore a surgery suit, and we sent her home with Telfa pads. So she would apply the Xerisil to the area on his back and then put the Telfa pad, and then he wore the surgery suit, and he tolerated everything. He was a great cat. He tolerated everything very well. And we also did fovea the day he was in the clinic too.
Nice.
We just did the one treatment because the owner scheduled a recheck, but then wasn't able to get him in a carrier because he wasn't a huge fan and he's a big cat. So she hasn't been back for a recheck, but she's been sending us updated pictures. This was about a week and a half after we saw him.
Oh, nice. Yeah.
Mm-hmm.
Oh, yeah.
Mm-hmm.
That looks nice.
And then this was 2 or 3 weeks after we saw him.
Oh, yeah. There you go.
So,
Fantastic.
Oh, nice. Yeah.
We still don't know the cause, but he's doing
would it
much.
be maybe the topical Frontline? Because we just had a cat that was similar.
Yes. So I meant to touch on that. So we did reach out to the manufacturer of Frontline, and they were not able to say yes or no if it was from that.
Sure.
I mean, it was a month prior and then it popped up. So it would be, they said the reaction time is most likely going to happen sooner. So it's very unlikely that the frontline caused it.
Got it.
But they can't say for sure.
Sure.
So could be, could not be, but he's healing really well.
That's awesome.
So it's going away. So
It reminds me of that cat we just had.
I know.
Same raw spot, same location, but they applied just a month prior, but the ears were awful too. So I don't know. But
yeah. So we don't know what really happened, but Xerasil is working beautifully.
Okay, fantastic.
Good to know.
On it.
Good to know.
Yeah. Might have to switch our cat to that. We didn't do that. I didn't do that. I just did steroids and antibiotics and ear stuff.
Yeah. But he's doing very well.
Rather than me talk about a case, I want to give an update on my case that we talked about the last week, which was also unfortunately hemangiosarcoma.
Oh, yeah.
Because the little schnoodle dog.
Yeah,
that was also hemangiosarcoma. And then I wanted you to give an update on your leg dog.
Oh, yeah. I was actually going to tell you that. Yeah.
Yes.
Okay, so the paw dog, which is backstory, it's the puppy that they don't know what happened outside, but the toe got degloved. It's the one that Dr. King was supposed to take, and then I took it, and we laugh about it.
Yes.
We're still doing bandage changes. We're doing them every other day to help out the owner. I got the culture results back. MERS-P resistant to everything. And then it had Enterococcus, which but I mean, it was susceptible to moxie. And I was like, all right, well, this dog needs something.
Yeah.
I have updated pictures. So we stalled out at this point in time as far as healing. Like there are obviously those other more superficial areas have healed nicely. But the toe is still, it has nice granulation tissue, but again, it's kind of stalled out on yesterday when we looked at it. But then there's a puncture spot on the back of the main paw pad that was small. And I think maybe there was some like more infection underneath the surface. So now that's broken open and it's bigger.
It's bigger, yeah.
And it looks still infected. It smells infected. So I'm stuck. Yesterday I was stuck between, do I keep this unwrapped to let it dry out and let the air hit it and just start like bleach sprays, things like that. But the puncture that opened up more is just, it was too large and raw that I was like, I don't want to do it just yet. Yeah. And the toe still was pretty much still just like fresh granulation and he's trying to still get at it. He's itchy as crap. So I told the owner we did fovea treatment on it. I'm applying mupirocin because they didn't test against mupirocin. Yeah. And then we're going to check it tomorrow. The plan is I think I'm going to just have to leave it unwrapped and we're going to have to try it. And then that way they can do the bleach spray. And I was like, it's going to hurt, but like he's got MERS-P. I don't know. We don't have many other options. They would apply the mupirocin and then he's on amoxi now because of Enterococcus. So.
Will he tolerate can they still clean it with like betadine or chlorhexidine?
Well, he's been allowing us to do hydrotherapy.
Oh, that's good.
So, I mean, it takes two people, but
they give him trazodone.
Right. He's still on trazodone. We refilled Rimadyl because he seems uncomfortable still. But yeah.
The other spots healed up on the inside of his. That's fantastic.
They look
good.
Beautiful.
Yeah, the suture spot is fine. I just need to take the sutures. And then there was another spot that was like almost delayed at scabbing, and then looks like the scab fell off, but it's superficial,
looks good
so it'll be fine.
Okay, well, good.
So it's a long road. She's medical, the owner is. I don't know specifically what. So when I was describing like fovea and all that, she was very open and receptive to it, and she agreed. Like she would obviously not like to have a bandage on, but.
Yeah, what do you do? I mean, they walk through, it's just so hard because it's his foot.
And it's like, I don't want MERS-P all over your house. You have kids, but I understand how it's trapping as well. So I don't know.
Yeah.
I'll have to show you the pictures,
balance.
but yeah, we'll see.
Cool. Okay, good updates.
Okay.
Okay. Keep using our text message feature for our podcast. You'll tap on the episode and the podcast provider of your choice. You look at the top, it'll say send us an inquiry through a text message here. You'll tap that link and then you can type whatever you'd like. If you do want a shout out on the podcast, you do have to leave your name. Otherwise it comes through as anonymous.
Okay. Cuckoo.
Listener question.
You do it, Kingling, over there.
Okay. Hey, VRT. My name is Jennifer, and I'm a freshman in college as a pre-vet major in California. I want to be a mixed animal practitioner, but I'm really interested in large animal theriogenology. I have 3 questions. From your travels, do you think there are any vet schools that are better at teaching farm medicine, or are they all relatively the same? 2, is it a conflict of interest if a veterinary professional has stock in veterinary product companies like Zoetis, Elanco, IDEXX? 3, I love vet shows. It's what inspired me to be a vet and maybe have my own vet show one day. But I'm curious, what do you think about them? Do you watch them? Do you think they can be better? Love the pod. You guys always make me laugh. Please bring back Positive Potato. P.S. Devin Fortune sounds like a cool stage name. Harrison is also a cool name. Karina, MBA, and future CVT.
The Positive Potato never left. He's on the table.
He's on the table.
He's right there,
You
just
just
not on the
can't see him.
couch.
He's in the studio. Don't you worry.
Okay.
I'll start with question 1.
Question 1. Do you think there are any vet schools that are better at teaching farm medicine? Yes, there are.
I did look it up.
Yeah.
Yes, there are.
There was a list.
Yeah. I mean, they're definitely. Now, can you learn it at any school? Yes.
Yeah.
But there are definitely, especially Therio.
Yeah.
Yes.
There are like some schools that are known for that particular aspect
Yes.
of large animal medicine.
Yeah.
Like even at, when I was up at LMU visiting their campus, they were like, hey, like our large animal, like we do it, but we're not like, I mean, look at the campus. We don't have a ton of large animals, so
Yeah.
like you're going to, it's different here than it's going to be at someplace else.
Right.
Yeah.
She was talking about it in light of like, if you're applying and that's what you're passionate about, because we were talking about admissions and things like that.
Yeah.
So I mean, they're definitely
Well, it's got
differences.
to make a difference where you're at in the country too, right?
Oh, for sure.
Yeah.
And what
So-
the needs are in the
Right.
different areas. What did you find out?
The list that it came up for me was Purdue.
Yep. For
Nor-
Therio, for sure. Yeah.
yeah, North Carolina State, University of California. Oh, did I say North Carolina? I don't know what I said. North Carolina State, University of California, and Davis School of Veterinary Medicine is the main ones it pulled up when I was researching.
Yeah.
I don't know if it's true,
Didn't know Purdue was at the top
but
there.
Purdue was
Yeah,
literally
well-
number 1.
Interestingly enough,
Yeah.
my sister's husband, follow me here now on this.
Okay.
My sister's husband's father.
Okay.
Okay, you got that? So my sister's husband's father.
Your sister's father-in-law. Okay.
Okay, yes. Okay. He was head of Therio at Purdue.
Oh,
Cool.
Yeah, so Jim Callahan was his name and did a bunch of stuff on cows.
that's really cool.
And he went to veterinary school at Ohio State. He has passed away, unfortunately. Maybe, what was that, 26 years ago, 25 years ago? But he was like the big guru.
Oh,
wow.
for Therio. Yeah, I know. Isn't that funny? It's so weird.
That is
So
so
weird.
odd.
Yeah.
I mean, we had a therogenologist teach us at school and stuff.
Mhm.
Maybe just because I wasn't interested in it. I didn't know we were good at it, to be honest with you.
Yeah, that's
Yeah,
where all
but-
his work was done. It was really cool.
Interesting.
cool.
But yeah, I don't
So-
know for sure about the other ones, but
I mean, Purdue
So
has a
let's
really
look into
nice
it.
large animal hospital. It's brand new. I can tell you
Yeah.
that. So,
Yep. Yep, very cool. Okay, question number 2. Is it a conflict of interest if a veterinary professional, I'm not sure what the definition of veterinary professional
anybody who works in a vet clinic,
yeah,
I would say.
think.
has stock in veterinary product companies, Zoetis, Elanco. Sorry, I was just making sure I read that correctly. Zoetis, Elanco, IDEXX. Richie,
I would think so.
is it a conflict of interest? No, I was going to say, I
Oh.
don't think it is.
Why not?
Oh, I was going to say it could be.
I know. Can't move,
Can't
the
move the
needle.
deal.
That is from the lawyer's mouth.
Okay, I don't know. I just
you
figured
can't
it
move
would-
the deal. Explain more, and we can explain
you
it to our audience.
Hi, Richie.
Richie's in house today because
This is
Because you're
Harrison
shocked
had to
doesn't mean
put
you're making
the
decisions.
twins to be.
Oh.
Okay.
Okay. Act in good faith, but also you could have it in your retirement funds.
And what you prescribe
401k.
is not going to move the needle in terms of.
Yes.
So, like, we're a Zoetis clinic.
Mm-hmm.
I owned Zoetis stock.
Yeah.
My purchase of Zoetis products for my clinic,
Yeah.
it didn't make a hill of beans difference.
Got it.
in
I
moving,
just felt like you made
in
that
moving
decision.
Zoetis's needle, like
Right.
it's not like, ooh, if I buy more, then somehow
see.
my stock is worth
Right.
more.
Because they're
It's-
huge companies.
Yeah, and they're so
Yeah.
far apart that
Right.
it doesn't make sense.
Right.
See, how I was thinking is that it would just like persuade that person who has the deal or whatever to then push that product more because then they might get more compensation or what. Like that's how I was thinking
Yeah.
about it, but that makes much more sense.
Well, I think that's what he meant by act in good faith,
Yes.
right? You don't allow that
Right,
to...
exactly. Yeah, that's just the one thing that
Yeah.
I was like, it could cause an issue,
Right.
but
But most of your kickbacks from manufacturing, like so from brands like Zoetis or IDEX or whatever, are all coming back to the clinic, not to the individual typically. So like, I mean, it flows through the clinic. I guess you could make it then flow to the individual possibly. But I mean, like it comes back in the form of like now you get this like percent like rebates off your products.
Right. Which goes to the client too. Yeah.
Right.
I got
I don't know.
That makes
That's like that reminds me. I just saw on social media. It was just like one of those satire, funny videos of, someone claiming veterinarians get kickbacks or something from recommending, like, we recommend certain diets and stuff. And the clip showed, I got this pen as a kickback. I got this hat,
literally
as
the squeeze
a
ball.
Yes, the squeeze ball. It's like we don't get squat.
A notepad maybe here and there.
Notepad, yeah.
Did anybody see the article about the IDEX being sued by all the people, all the different states?
No,
because of lab prices. Did you see that?
No.
Okay, remind me. We got to talk about that next episode.
That could be the next trending
because
topic.
the judge ruled against it and said no. These companies, like the veterinarian, like it's very interesting. IDEX doesn't. It was about like Richie, what's it called when you're in like you take over everything? Yes, monopoly. Thanks. Yeah, Richie needs to join us on the podcast.
Yeah, no kidding.
So anyway,
Richie is Dr. King's husband, FYI.
It's a fascinating case. I'll remind me.
I just texted our group chat to remind us.
Okay, question 3.
Question 3. What do you think about TV shows, vet TV shows?
I'll be honest, I don't know if I can say I've watched any.
She asked, do you watch them? No.
Nope.
No.
I do it every day.
Mostly because I don't think they're... I don't know if I've seen... Now, the comedies that I've seen, like there's that one with the guy from... I'm not good with details. I'm sorry.
That's okay.
It's out right now, and it's like they're animal control.
Oh, that's what it's called. Animal control.
Is it called animal control?
Yes.
Look at me.
Yeah.
Okay.
The ones where they go and pick up dogs or whatever?
Yeah.
Like, I've seen
comedy,
those here
like that's
Sure.
funny, but like a vet, like about actually veterinary specific tasks and jobs.
Right.
I think they have, I mean, because of editing, they leave out so much.
I know. I
don't think it's realistic.
I will say growing up, and I was Animal Planet, Die Hard, Emergency Vets was the show I did watch growing up that did actually make me want to be, part of the reason why I was like, ooh, I want to be a vet.
Yeah.
So like it did have an influence on me at some point in life, but I think, I don't know, maybe it's because again, once you get into it, you know what it's like. You don't really have to watch it because you're living it.
Maybe that's what it is.
Yeah. Jacob, he was flipping through the channels one morning and he found a show that, they just film a vet that works every day in a hospital, and he's like, do you want to watch that? I was like, no.
No.
Yeah.
It doesn't interest me.
There probably are some good ones. Right. That are out there
I wouldn't doubt
nowadays,
that.
That are actually show you what's happening.
Different ways to do medicine that I don't want to, it's not fair to me to watch it. And like, I don't want to have any preconceived notions or judgments on that, because it's like
everybody practices differently.
Yeah.
Well, and that's what I mean. Like, they don't tell the full story. So then I'm passing judgment on somebody that
I'm like, you're doing that wrong.
Yeah.
Yeah.
I mean, if you enjoy them, there's no harm in watching them, but I'd be interested to see if you still like them
once you are in it.
Yes.
Yeah, I agree.
I don't, because there's that separation. You get home, you don't want to think about it anymore.
Yeah.
I'd rather watch something that's gonna just
Yep.
completely unrelated.
Yes, like Severance.
Yeah. Like Severance. You want to sever your brain when you leave the vet clinic.
That's right,
so you don't
Maybe
remember.
I should watch that.
It's very trippy.
It's weird.
It's very weird. But
Yeah.
I mean,
don't watch it.
It's entertaining. It's just weird.
It's just weird.
You know what my current favorite TV show is right now?
No.
That I used to be super into and I forgot about it? Naked and Afraid. Have either of you seen that?
Oh my God, Richie used to watch Naked and Afraid all the time.
Random.
I love that show. I don't know. It's so interesting to me. And I had it on. I got home last night and I sat down to eat dinner and I turned it on and Jacob was like, I'll come sit with you. And he was like, nope.
Nope, I will not.
Because like the animals and the bugs are eating. I was just like chowing down on my dinner and Jacob was like, so our TV's here. I'm sitting here. Jacob's sitting right here. And he's just like staring at the wall the whole time while he's eating because he can watch the show.
Oh my God, that's amazing.
That's I like
so
the
good.
I don't watch that one, but we've watched Alone, where they literally get dropped off in the middle of nowhere and have to survive. Last one standing gets, I don't know, money,
like Naked and
or
Afraid.
something. Yeah.
Kind of.
Yeah. They're just not naked.
They're just not naked.
Oh, you're right.
They get 3 tools or whatever.
Yeah.
Yeah. So
I just love it. It's so good. I don't know why.
I think we should participate in the one that was on Fox this year where the people could excavate you if needed. Like do you know what I'm talking about? It was on Fox. And again, I won't be able to come up with a name because I don't know any details. But the family members or whoever are on the outside and they drop their person on the inside. And you're the only one allowed to get the person out of the situation. Your family is. So you're sitting there going, I'm ready to come home. Like, let me come home. And the family's like, nope, you're staying there.
Oh,
don't set me up with
no, I'm saying the three of us go do it.
Why would you want to do? I don't want you guys to control what I do.
And so then, like, if you stay in it, like whoever stays in whatever this experiment is the longest wins the money. And so then you can give your family stuff. Like you're on the people that are in the studio are competing for things. I think. Like, like a drop box for who, like if you win it, now your person gets this or whatever.
Yeah.
But there was apparently this mother and father, and they dropped their son. The son was like, if you do not get me out of here, no. And the parents were like, nope.
Oh my God.
I would make some serious threats to you guys.
I don't know.
I was like, this seems like Divergence, whatever that show is.
Yeah.
Yeah. Like very much like.
I don't think so.
Scary.
I don't think it sounds healthy for a family dynamic.
Let us know if you would watch a TV show about the Roundtable, but not that.
Yeah, not that exactly. Oh my gosh!
I threw out a classic. Watching Wildfire. It's from 2010. It's on Netflix. It's about a horse.
Okay.
No surprise.
I watched it in like middle school or high school. It's very family oriented.
Rewatching, huh?
It's about the story of a horse.
My comfort show is The Big Bang Theory.
Oh,
so good. I could talk about TV shows all day.
I know. Okay.
Thank you, Karina. We appreciate the question.
Yes. Okay, well, that's it. So thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or a previous one. We'll see you next week for another episode of the Veterinary Roundtable.
Thank you.
Bye-bye.